Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey joins us again this week. Thank you for taking the time, Doctor.
Hi, good afternoon.
Good afternoon. My name is Dilshad Burman. I am a writer and reporter with City News and 680 News, and I will be moderating this chat today. Now, the questions for this chat have been coming in all week. If you haven't had a chance to submit your questions, you can still do so under this live broadcast. We'll try and get to as many live questions as we can. We've also got a whole bunch of submitted questions, so we're going to get started right away. Doctor, are you ready?
Let's go.
All right, let's go. So we'll start with a question that actually 3 people have asked a very similar question here. We've got Laura, RS, and Joy asking a very similar question. So I'll just read out one of them. Laura says, my grandson tested positive and is asymptomatic. Why is it okay for him to return to school and work after 14 days without taking another test to confirm that he is negative, as per a letter from the Ministry of Health? He lives with me. Does this mean that he is no longer contagious?
Okay, so we know that there are a certain small proportion of people that, or actually we don't even know how many, who have asymptomatic infection. And because we don't know exactly when their symptoms started, sometimes asymptomatic infection means that they actually have mild symptoms. Like they might have had a bit of a runny nose and they just don't pay attention to it. Sometimes that's what it means. But because we don't know when symptoms started or when they were contagious, we take the day that they were tested as the first day, as day 0, and then they're simply isolate for 10 days afterwards. And so we know that everyone who has symptoms, most people who have symptoms, 10 days after the start of their symptoms, they're no longer considered contagious. So someone who's asymptomatic might actually stop being contagious somewhere in there, even before 10 days. They're very unlikely to be contagious past 10 days. The reason why we don't do another test is because if you do another test, it actually might be positive. We know that you can be shedding the virus persistently after even 10 days, but it doesn't necessarily mean that you're contagious. And so that's why we use that approach.
Okay, and so in that case, it is safe for them to go back to work or school, and they're not likely to infect anybody else.
That's right. And so, and like the people who might need more than 10 days if they were hospitalized or they had a really weak immune system. But again, because you're asymptomatic, you were not hospitalized for your infection. So, but even still, someone who's asymptomatic and test positive has to self-isolate at home and keep themselves protected from others in the house when they're doing that.
Okay. And then couple of more testing questions sort of related here. Cindy asks, is it possible to test positive at day 3 and then negative for COVID-19 13 days after symptoms first appeared?
Yes, it's possible. We actually know that you can actually be intermittently positive. So, and so it's the one positive test that we use that we take action on, especially if you have symptoms. Again, you're symptomatic for 10 days from when the symptoms started. So by day 13, you're not considered infectious anymore. You're not contagious anymore. If we test you, you may be positive or you may be negative, but there's not much weight to put on that test result at day 13.
Okay. So Gunia asks, one of my family members was COVID positive. He just had a fever for one night and then everything was okay. We shared the same space all the time before he got tested. But a week later, when the rest of my family got our tests, we were all negative. How is this possible? None of them caught the virus. And she says she's heard this from 2 other families. One member is positive, everybody else remains negative.
Yeah, so I mean, we don't always know why some people can spread it to others and others can't. You've heard of those super spreader events, and we think some of the super spreader events are the person even a day or 2 before their symptoms started, so they couldn't take precautions. They may even be the most infectious at that time. And so it may have been when the person in your household was the most infectious, you were not around them. It could have been that you were following precautions in your own home, washing your hands. And some people are also talking about an infective dose. And we know this is the case for some other contagious diseases where you may be positive, but you may not have enough of the virus to actually consistently spread it to others. And so that might also be playing a role here.
Okay, that's really interesting though. So you can be contagious and still might not be able to actually pass it on effectively to other people. If effectively is
That's
the right.
right. Yeah, you might, exactly. And some people might spread it to many people. Some people might not spread it to as many people. This is all the stuff that we need to keep researching to be able to understand, because we want the person who's not able to spread it to others. And I think one thing that you should see is, was it based on your practices in your home that you were able to help prevent it? I mean, it sounds like you were around them more often. The other thing to note is sometimes when you get a positive, especially in someone who doesn't have symptoms, they actually could have had the infection previously and were contagious previously. So that sometimes is also the case, and we can do further testing to see if we can figure out whether that might be the case as well.
Okay, so we've got a few live questions coming in right now. Let's take a few of those. Helen asks, firstly, is it possible to get COVID twice?
Yes. It is possible. It has been documented. We certainly wouldn't want that on anyone, but it means that if you've had COVID, you can't consider that your vaccine. You're going to have to keep taking precautions so that you don't get infected again.
And then Helder asks, it took 25 years to make a vaccine for chickenpox. How do we make one for a killer virus that works for everyone?
Yeah, isn't that a great question? And I know the fact that we can even have vaccines that are in the pipeline that we're doing clinical trials on is really, really fascinating. I think the one thing to note is the pandemic viruses, classically it was influenza, and we knew if we had an influenza pandemic that we would start working on the vaccine and be able to get a vaccine within a year. Now, we already have a flu vaccine. We actually don't have a coronavirus vaccine. But I think why we can actually get ahead is because there have been people who have been researching this before even COVID-19 or SARS-CoV-2 came along. And but I think the trials are going to be really important to see if these new vaccines are actually effective, because that has been part of, in the past, vaccines have been developed, but either they're not safe or they don't work as well, and that's why they don't come to market.
Right, absolutely. And so we've actually had a lot of questions even submitted over the last week asking about vaccines. Is Canada developing a vaccine, and how far along are we in that sense?
As far as I understand it, Canada has procured the vaccine, meaning they've, from certain manufacturers or said that they would buy a certain number of doses. Even still, the vaccine has to be licensed in Canada. And so what that means is that any vaccine that you take has to be tested, licensed, and approved by Health Canada before it can be given in Canada. So, whether a vaccine is coming from the cell right up, doing all their trials in Canada, I'm not aware of that. But in the global context, we can make use of vaccines that are well along in development to be used in Canada with particular Canadian licensure.
Okay. And then there's another live question coming in right now. Is there any indication of potential interaction with the flu vaccine for those who have tested positive for COVID in the past?
So there was some research done to answer that question, and it doesn't seem that there's any indication that the flu vaccine will interact with either SARS-CoV-2, someone who has COVID, to give you any adverse events.
Okay. And then let's go back to our submitted questions here. Once again, more about interacting with people who had COVID. JJ asks, a coworker tested positive. He worked a different shift than myself, but I used the same desk as him 5 days later, which I did clean. Is there any risk to me? And also, is there any way to find out where he contracted it?
So the biggest risk to you would have been if you actually had face-to-face contact with the person. That is still the biggest risk. It's that close contact. As Dr. Davila says, you get COVID from people, not from places or things. And so sharing the desk, that's why we're saying, like frequently touch surfaces, you got to clean and disinfect them before you use it. So, and if you used it 5 days later, the chance of that the virus was on the desk, survived your cleaning, and was there and able to actually infect you would be extremely low. Now, the question of, well, where did they get it? That for them to know and to figure out. That kind of information is personal health information. But what I can say to you is the vast majority of people, 60%, 50 to 60% at least, know of someone who they had close contact with who had COVID, and that's how they got it.
Okay. So basically, more than likely, this person is quite safe working at their desk. Very little chance of catching it from the desk, and very little chance of, if they didn't interact with the person, then there's no risk there.
That's right. And so we would actually consider that a low risk exposure for sure.
Right. Another one coming in live right now. Finnish Granny asks, I'm in East York and I'm 66. I want to know if I can watch my granddaughter, who's also in the East End of Toronto, over the Christmas holidays. I have been isolating since the beginning of COVID, have rarely seen my granddaughter. The granddaughter is 6 and in senior kindergarten. Her mom also works outside of the home. Is there any way that I can make it safe to babysit her?
So obviously with babysitting, you have close contact with someone. And so I think you're going to have to be able to assess your risks and the situation at the time. I think by Christmas holidays, it's actually a lifetime away. It's actually almost 6 weeks away. And in COVID days, that's actually a long time. And so we'll have to see where we're at in terms of the spread of the virus in the city. What I can say is that your granddaughter who's in school, I mean, the risks in school seem like schools are doing very well so far. And we know that what is playing out is children are if they're getting COVID, they're not as sick with it. And they're actually less likely to spread it compared to adults. Now, they could still spread it. We know that a lot of kids are actually getting COVID from other adults rather than getting it at school. So I think that's all promising, but I mean, there's always risk in everything. And so what I would say is it's hard to give you a clear definition of what the risks will be in December. So we can maybe revisit it closer to the holidays.
Right, absolutely. And I think something that we've been discussing over and over is you have to make these decisions for yourself and assess your own risks, right? It depends on how often has Granny been leaving the house? How often has she been interacting with other people? Has there been a COVID outbreak in the child's school? So many different factors that that play into your risk assessment of the situation.
Yeah, and for Granny, Finnish Granny, you're 66, but do you have any other health conditions? What are your risks and how much of a higher risk are you if you were to get COVID? So.
Yes, absolutely. Okay, we'll go back to some of the submitted questions over the week. We've got 2 questions regarding COVID symptoms. Zeba asks, I have fever and diarrhea, but no cough and no sore throat. Could it be COVID?
It could be COVID, yes. So with those symptoms, you shouldn't be going to work. You shouldn't be going to school. You should stay home, get tested. If your results are negative, then you don't need a stool sample for COVID. But especially with the fever and diarrhea, if you have any sort of respiratory symptoms and diarrhea, it definitely could be COVID. And so you need to get tested. That's the only way to ensure that you're safe to return back to your activity once your symptoms are improving.
Okay. And then Katko asks, is earache also in the realm of COVID symptoms?
It's not labeled, like for children, earache is not one of the labeled symptoms. So now sometimes if you have a sore throat, that can give you an earache, for example. So in that way, it could be, but an earache alone is not something that is on our symptom list right now.
Right, it's not an isolated symptom. It would probably be related to stuffy nose, sore throat, that kind of thing.
Exactly, yeah.
Okay. So Dharmesh asks, a couple of travel questions here. Dharmesh asks, can the Toronto Public Health guarantee COVID results will be available in 96 hours? Because that is the requirement before one boards a flight. You have to have a negative test for 96 hours.
So unfortunately, Toronto Public Health is not the lead for testing. It's Ontario Health. And so I would ask this question to Ontario Health. The place where you get tested, you could ask it of if you're going to a pharmacy or to an assessment center to see what their turnaround times are. On our website, we do have a graph that shows what are the turnaround times or what percent are meeting the target within 1 to 3 days or so. But unfortunately, I'm not going to be able to answer that question for you. But it is a really important question, especially I know as people need the testing for travel.
Yes, absolutely. Okay, so let's see. Amina asks, is it safe to travel to India if it is really urgent along with my children?
Well, I wouldn't say that it's safe, but I think if you have to go, you have to go, and you can find ways to do it safer. We know that travel is a risk for getting COVID. We know that India is actually experiencing unprecedented numbers compared to other parts of the world. And so if you have to go, then you will need to take precautions. And the precautions that you will take during your flight, during your travel, and while you're in India are actually the same precautions that you would take when you're here.
Right, absolutely. And then once you come back, you have to isolate for 14 days, no question about that.
That's for sure, yeah.
We've got another live question coming in. Let's take this one. Mary asks, the numbers are higher now than they were in the lockdown. What is the difference between now versus then?
Yes, so part of it is the people who are getting COVID now compared to in the lockdown. In the spring, we had a lot of older adults who were getting it, a lot related to long-term care homes, a lot more deaths and hospitalizations associated with COVID in the lockdown. We also weren't testing everyone. So everyone who had symptoms was not eligible for testing then. So we can't quite compare it. But what we can say now is that it tends to be younger adults who are getting COVID. In general, they are getting less sick with COVID. And so the daily number of cases is one thing to look at, but if you go to our website and you go to what's called the monitoring dashboard, you can see we have another indicator that looks at healthcare capacity. And you can see right now that those indicators are in green, and that we're not seeing tons of hospitalizations or ICU admissions as we had seen in the spring right now.
Right. And in terms of, why are cases increasing? Why are we seeing a second wave? Is this connected to our public health measures? Are we not doing enough? Is there more to be done? Basically, why are we even seeing this second wave? Because we took so many precautions.
Well, we knew we were anticipating a second wave. We know with pandemics you get one wave and then you get another wave, and sometimes you get another wave after that as well. So we were preparing for this in the fall. We did know that when we were loosening our measures, when we went into stage 3, that we could expect to see more cases. I think that has definitely contributed to the start of the second wave. And then now it's getting colder and we're going indoors, and some of the places where people are getting COVID can be prevented, but they're not necessarily following those public health measures. And so I think that's part of why we're seeing the second wave. Now, Toronto has been in the modified stage 2 for a number of weeks. And while the numbers are continuing to rise, it's not that exponential growth. It's not that doubling every so many days that we had seen late September and early October. And so that's a very positive sign. But the cases are still quite high. And so I think it just means that it's a call to action for all of us, that if we all take that step, use those precautions, put them in place, we can fight this, because we've seen other places around the world have been able to do that.
Right, absolutely. Let's jump back into a couple more questions here. Mohammed asks, I just traveled domestically from Ontario to Alberta by air, masked up the entire time. Should I get tested?
You won't qualify for testing just because you traveled. That's one thing to say. I think if you have any symptoms, definitely should be tested. Right now, there's no requirement that you be in quarantine per se. But usually when people travel, especially if they're traveling for vacation, when they're on vacation, they like to meet up with other people. They like to go out and congregate, have gatherings. And so if you were participating in any of those things, we know that Alberta has had a number of cases as well. Please be mindful of your symptoms and isolate and get tested if you have any.
Absolutely. And then Erica has a similar sort of travel question here. She says, we live in the region of Peel, and currently the 3 of us are working from home. My husband is 63, has high blood pressure, and is supposed to travel for work for 4 days just to Windsor. Do you see any health issues for this traveling?
Well, again, I think we have to find ways to do it safer. I would definitely say don't carpool. If you're driving, drive alone. Carpooling has proven to be a very high risk activity, and you don't actually really think about it. If you have to travel, then you take your precautions when you get to Windsor. And you expect that everyone that you meet or have an encounter with could be positive for COVID. And so you keep your physical distance, you wear your mask, all of the same things that you would do here, that you would do there as well.
Okay, and then we've got another one coming in live. We actually addressed this slightly earlier, but we'll do it one more time. Mimi says, I got tested, I was positive on October 15th for COVID-19. How long will the virus stay in my system?
So you're considered contagious for 10 days from when the symptoms started. Now, we know, though, the answer is tricky. How long will the virus stay in your system? We know that you could actually test positive even 120 days later, but it doesn't necessarily mean that you're still contagious, but the virus is in your system, so to speak, and that you can detect it. So you know, it's hard to know what to make of that. Whether that means that that the virus is still impacting your organs or not. I don't have the answer to that piece, but it can still linger in your body for that long.
Right. And in fact, we've been talking about COVID long haulers over the past few weeks with this thing that the virus can linger in your body. And so many people have been seeing symptoms well after the 15 days. It might not be cold, cough, fever, but it's things like fatigue and other things. So we're still studying all of that, right? There's a lot more research to be done.
Yeah, there are some papers that have been put out, some clinics that are actually following this. To see and to be able to clearly articulate what it is that in these long haulers and what might explain some of it.
Right, absolutely. Here we go. Lalita asks, and this one is important. I am due for a yearly mammogram as a breast cancer survivor, and I'm afraid to go to the hospital to get the test. What should I do?
Don't be afraid. I think that, you know, if you are afraid, I would say call the hospital, the radiology department, ask them what their precautions are that are in place. Hospitals have a mandatory masking policy, so everyone who comes in wears a mask. The technician who will set you up will be wearing full PPE as well, so the likelihood of you getting it from them is minimal. They will have protocols for cleaning and disinfecting the mammogram to make sure that there's no contamination from people. So I think that it can be done safely. And I think one key message is that if you need healthcare, there are safe ways to get it. And if you're concerned, please do follow up, but don't decide to just cancel it thinking that you don't want to take the risk of COVID.
Right, especially for a cancer survivor. I mean, those are vital. Those tests afterwards are vital to make sure that it hasn't come back or you're progressing properly.
Yeah, and I think the other thing to note is, you know, you're due for your 1-year mammogram. Well, you could postpone it, but how long will you postpone it? I mean, we could be in this wave 2 4 months, actually. Sorry to say, but that could be the case. And so it's really the question of how long can you really postpone it and it still be safe for you, for your health.
Absolutely. I think a lot of people, like you said, it's going on for months. We're hoping that, you know, when the clock strikes 12 at the end of 2020, we're going to be out of this, but really it could be going on well into 2021 as well.
That's right. Yeah.
Yeah. Okay, let's go on to some more submitted questions here. Nathan asks, there's a little bit of math for me here. Nathan asks, if middle school children are in school, usually with 16 to 20 kids per classroom, that averages about 1,000 square feet with 8 to 10 foot ceilings, why are kids of the same age group then restricted to practices only instead of league games with 10 skaters per 17,000 square foot pad of ice with 20 to 30 foot ceilings? Essentially, they're closer quarters in school, but there's so much more room in an arena. Why is there restriction? Why are the restrictions different?
Yeah, so I mean, when you're in school, especially middle school kids, are all wearing a mask for the day. They're keeping that distance as much as possible. They're washing hands. They're screened before they enter to make sure that they stay home. And they're doing it for school, to be able to attend school, which is really important. Now, I agree with you that I think that you can actually participate on the ice in safer ways, but that face-to-face contact, scrimmaging on the ice, I mean, that is close contact, and you're not wearing masks The kids are not wearing masks when they're on the ice. The other question is on ventilation in those places. I think the arena itself probably has good ventilation, but what about in the change rooms, for example? So there are a number of things like that that can make it, have more risks. I think the bigger risk, though, that we've seen with sports and sports teams is also the before and the after sport. People congregating in the parking lot or maybe going out after to get a bite to eat. And then that's how it's spreading as well. And so that also has to be taken into account.
Okay. And then let's see, what else do we have here? NN asks, when the province reports deaths from COVID, why aren't the ages of the deceased reported?
I don't know specifically about the provincial reporting. I think if they're talking about case by case, they're trying to protect people's privacy. But overall, you can find death statistics by age group. I know that, and so that should be available to find.
Right. I think individual ages is probably a privacy issue, and that's probably the main issue there. Okay, Christiana asks, just wondering why the government does not request every person to wear masks outside, because so many people are still not keeping their social distance when wearing masks. Do you think this is one of the reasons that is causing the rise in cases?
Well, for sure, outdoors, people feel that outdoors is safer, and so they may lose their public health precautions when they're outside. And we definitely, Toronto Public Health, recommend that when you're outdoors and you cannot keep that physical distance, wear masks. So if you're attending an outdoor wedding, have all your guests wear masks. If you are, your children are participating in soccer practice, wear a mask. I mean, if you can wear a mask, wear a mask. If you're just walking down the street and you're the only one and there's no one around you, obviously the need for a mask there is much lower. But there's no question that we would recommend that if you are outdoors and around people, cannot keep that physical distance especially, yes, we should be wearing masks outdoors in those settings.
Absolutely. I think a couple of weeks ago you mentioned as well, there are some outdoor settings where you really should be wearing a mask, especially if you can't keep that physical distance, whether it's a grocery store, or those of course are mandatory now, but whether it's any sort of place outside, if you're walking down the street, especially where I live, it's crowded, even morning joggers are out all the time. So there are certain outdoor situations where you still should wear a mask.
That's right. Yeah.
Okay. And then we have Bernard asks, do we know how the virus is spreading so much these days? Are people who are getting it now either A, not wearing a mask or in close proximity to people who are not wearing masks, or B, not washing their hands and then touching their face? If we do these things, are we generally going to be safe?
The more likely way that people are getting it is from being in close proximity with others and not wearing a mask, not keeping the physical distance. The classic example is in workplaces where people will keep their precautions in front of the customers, maybe when they're on an assembly line, whatever the kind of work they're doing, and then they'll go back and either carpool with 3 other people, or they'll have a lunch, and at lunch you take your mask off, you eat your lunch, and if you're not keeping that distance, that can be a high risk. And so those are the types of settings that we're seeing it. We're also seeing it in social settings as well, where people are still gathering, either for events, for celebrations, or for family gatherings, where it's spreading as well.
Right, absolutely. We had another wedding recently where there were 44 cases, and so those things are still going on. Those become super spreader events quite quickly.
That's right. And you don't want your wedding to be known as the wedding where everyone got COVID. So I think we're just going to have to switch to that new way, that new look during the wedding.
Yeah. And there are so many ways to do a wedding safely. We've recently done a story about it as well. And you can actually check out that story on citynews.ca/COVID answers if you want to see safe wedding protocols. We incorporated a lot of Toronto Public Health protocols in that story. So that was just my little plug. We'll move on to another question here. Vicky asks, she would like to know the approximate lifespan of an N95 respirator, if only worn for an hour at a time, a couple times a week. Basically, how many times can she use it before it sort of is no longer effective?
You'll have to check what it says on the mask. I mean, each N95 mask is very different. I know at the hospital we have many different brands. One brand that may work for one person doesn't work for another because you have to be fit tested for it. So I think you're going to have to check with the manufacturer, with the brand, to see what they recommend in terms of reuse of an N95 mask.
Okay. Okay. Yeah. Generally, depending on the filter, there's a number of hours that it's got a lifespan basically, and it's different for every mask, like you said.
But the one thing that is clear is that if it's wet or moist on the inside from wearing it, even if you're wearing it for an hour, if it's dirty, if it's soiled, or if you've been with in certain areas, well, then you'll have to discard it right away. So you'll have to determine all that as well.
Okay, and I'll just squeeze in this last question that's coming in live right now. Nicole asks, because you just mentioned carpooling and we shouldn't be carpooling, why are we putting school children on buses if we shouldn't be carpooling?
So when school children go on buses, they're wearing masks. There's also a seating plan. They're washing their hands before they get on. And if there's a case that's identified on the bus, that's considered a bus cohort. The whole bus is excluded as well. So that's why buses we're allowing them because we do have those public health precautions in place. Unlike being on a transit system where you don't know who you've been sitting beside, unlike being in a ride share where you may be sharing with other passengers who you don't know, this can be traced, so you can influence the cohort to self-isolate them if you need to for contact tracing.
Okay. All right, and with that, we are at 1 o'clock. Once again, the half hour just flew by. Thank you to everybody that submitted your questions live. That was a really interactive session today. And thank you, Doctor, for taking the time once again.
Okay, bye to everyone. Have a good afternoon.
Bye. Thank you for joining us, everybody.